My name is Victoria Kelly, and I will be discussing mother-to-child transmission of HIV, focusing in on Thailand and Nigeria. Mother-to-child transmission is also abbreviated as MTCT throughout the PowerPoint. This is an image supporting HIV mother-to-child transmission and trying to eliminate it. So a background and a history on HIV is that HIV is the virus spread through certain body fluids that attack the body's immune system, specifically the CD4 cells, often referred to as T cells. Over time, HIV can destroy so many of these cells that the body can't fight off infections and diseases. These special cells help the immune system fight off infections. Untreated, HIV can reduce the number of CD4 cells, or T cells, in the body. This damage to the immune system makes it harder and harder for the body to fight off infections and some other diseases or cancers. Opportunist infections, also known as OIs, or cancers, take advantage of a very weak immune system and signal that the person has AIDS, which is also known as acquired immunodeficiency syndrome. Scientists identified a type of chimpanzee in Central Africa as the source of the HIV infection in humans. They believe that the chimpanzee version of the immunodeficiency virus, called the simian immunodeficiency virus, or SIV, most likely was transmitted to humans and mutated into the HIV we know today, when the humans hunted the chimpanzees for meat and came into contact with their infected blood. Studies show that HIV may have jumped from apes to humans as far back as the late 1800s. Over decades, the virus slowly spread across Africa and later into other parts of the world. We know that the virus has existed in the United States since at least the mid to late 1970s. There are different subcategories of how HIV can be transferred from one person to another. Specifically in this lecture, I'll be talking about the transmission of HIV from mother to child. The transmission of HIV from an HIV-positive mother to her child during pregnancy, labor, delivery, or breastfeeding is called mother-to-child transmission. In the absence of any intervention, transmission rates range from 15 to 45% chance that the mother will give the child HIV. This rate can be reduced to below 5% with effective interventions during the periods of pregnancy, labor, delivery, and breastfeeding. These interventions primarily involve antiretroviral treatment for the mother and a short course of antiretroviral drugs for the baby. This also includes measures to prevent HIV acquisition in the pregnant woman and appropriate breastfeeding practices. The new Sustainable Development Goals place heightened emphasis on the prevention of mother-to-child transmission in the context of better health for mothers and their children. This graphic was presented by the Centers for Disease Control and Prevention, and it states, "Women in HIV. Did you know that around 1 in 4 people living with HIV is a woman?" That's about a quarter of all the infected people, which gives an opportunity to transfer it to the child. Not all women are equally affected by HIV. 61% are black, 19% are white, 15% are Hispanic, and 4% are other. Only about half of the women diagnosed with HIV have achieved viral suppression. To learn more about these HIV facts, treatments, and tests, you can go to cdc.gov/HIV. Description of HIV. The person-to-person spread of HIV is called HIV transmission. HIV is transmitted or spread only in certain body fluids from a person infected with HIV. This includes blood, semen, pre-seminal fluids, rectal fluids, vaginal fluids, and breast milk. HIV transmission is only possible if these fluids come in contact with a mucous membrane or damaged tissue, or directly injected into the bloodstream from a needle or a syringe. Mucous membranes are found inside the rectum, vagina, and opening of the penis and the mouth. HIV is primarily spread by having anal or vaginal sex with someone who has HIV without using a condom or taking medicines to prevent or treat HIV. Sharing injection drug equipment, such as needles, with someone who has HIV is often another way that it is spread. HIV can also be spread from an HIV-infected woman to her child during pregnancy, childbirth, also called labor and delivery, or breastfeeding. This spread of HIV is called mother-to-child transmission of HIV. In the past, some people were infected with HIV after receiving a blood transfusion or organ donation, tissue transplant from a HIV-infected donor. Today, this risk is very low because donated blood, organs, and tissue are carefully tested and filtered out in the United States. However, this is not always the case in other parts of the world. To reduce the risk of contracting HIV, a person should always use condoms correctly during vaginal, oral, and anal sex, and only inject drugs with sterile needles. This means that you should never share a needle once it's been used. There are misconceptions on how you cannot get HIV. You can get HIV by having sex without a condom, passed from mother to baby during labor, delivery, or breastfeeding, sharing injecting equipment, which are needles, or contaminated blood transfusion and organ transplants. In the United States, this is not much of an issue, but in other parts of the world, it is. You cannot get HIV from kissing, hugging, sharing food, insect bites, which is often a misconception that mosquitoes will give you HIV, toilet seats, bathing, sneezing and coughs, or sweat. So the demographics of Thailand and Nigeria. Thailand has 450,000 people living with HIV. As of 2016, it eliminated mother-to-child transmission of HIV. Its entire population includes 68,414,135 people. The primary religions practiced are Buddhism and then Muslim. Its geography is that it's located in southeastern Asia. The primary ethnicities are 97.5% Thai, 1.3% Burmese, and 1.1% other. The demographics of Nigeria include 3.2 million people living with AIDS. Nigeria consists of 30% of the total global mother-to-child transmission of AIDS, which is quite a large portion, which is more than a quarter of the entire amount of the globes. There are 75,000 new infant HIV transmissions a year. Its total population is 190,632,261 people. The primary religions practiced are Muslim, Christian, and indigenous beliefs. The geography is that it's located in Western Africa. Its ethnicity is composed of over 250 different groups. The most popular in numbers are listed below. Nigerian women culture. They are usually the primary caregivers for children and the elderly. Like many cultures, women are placed with the responsibility of being the primary caregiver of children and the elderly. This creates a level of emotional, physical, and financial stress placed on the female. They are submissive to their male counterparts in relationships and in the community. Often the culture views the male figure as the leader of the family and community, and the females must tend to the males in their lives. The women are often second to the male in the household and in the community. Being in a third world country, Nigerians are often faced with extreme poverty. This makes it difficult to prevent against contracting AIDS in the first place, treating AIDS, and especially preventing the spread to one's children. There are poor living conditions, and poor sanitation is a constant burden on the woman and the rest of the community, who must deal with this on the daily. This increases their susceptibility to contract different diseases and bacterial infections. Once a person has HIV, their immune system is suppressed. So an increase in different diseases and their susceptibility would make it much harder for a person living with HIV to survive in Nigeria than in other parts of the world, such as the United States, where they are treated better and have more treatment options and better sanitation and living conditions. There is a lack of education in Nigeria as a whole, but the women are subject to suffer a lack of education the most. Lack of education decreases opportunities to better oneself. Women often must tend to home life and their families, and education does not fit into this structure. Overall, there is a lack of access to healthcare, including nurses, doctors, clinics, and hospitals that are fully staffed and equipped. There is also a general lack of transportation methods in Nigeria. On gender and household poverty in Nigeria, the World Bank suggests that the poverty of female-headed households may be related to legal, regulatory, and cultural barriers that keep women disadvantaged relative to men in terms of access to health, education, financial, and agricultural extension services. Prevention of mother-to-child transmission, also known as PMTCT. Earlier antiretroviral therapy, or ART, for a larger group of HIV-positive pregnant women to benefit both the health of the mother and prevent HIV transmission to child during labor, pregnancy, and breastfeeding. Longer provisions of the antiretroviral prophylaxis for HIV-positive pregnant women with relatively strong immune systems who do not need the ART for their own health. This would reduce the risk of HIV transmission from mother to child. Provision of the ARV prophylaxis to the mother or child to reduce the risk of HIV transmission during the breastfeeding period. For the first time, there is enough evidence for the World Health Organization, also known as the WHO, to recommend ARVs while breastfeeding. Globally, there are still more than 1.4 million pregnant women with HIV as of 2016, which estimated 76% receive the antiretroviral drug to prevent the mother-to-child transmission. Thailand's success in the elimination of mother-to-child transmission of HIV. They have a strong support from the government. The government has put large amounts of funding into the prevention of mother-to-child transmission of HIV. Unfortunately, with any health change, money and access to funds is necessary to evoke lasting change and success. They have integrated prevention of mother-to-child transmission interventions into maternal and child health services free of charge. Routine HIV testing for pregnant women and their partners is an essential element for the success. Mothers diagnosed with HIV and their exposed infants are followed up through the health facilities linked and supported by their communities. Infants exposed to HIV are monitored until the age of 18 months if they are breastfed. There are quality-assured diagnostic services for HIV, and they're accessible and provided free of charge. Laboratory use and testing strategies and algorithms have been recommended by the World Health Organization. The integration of the prevention of mother-to-child transmission of HIV. In Thailand, there is currently 450,000 people living with HIV. 1.2% estimated HIV prevalence among adults ages 15 to 49 years. There's an estimated 19,000 AIDS-related deaths yearly. And still, Thailand was able to completely eliminate mother-to-child transmission of HIV and prevent the child from inevitably contracting AIDS. With a strong governmental support system and adequate funding, the system Thailand used to eliminate the mother-to-child transmission of HIV can be implemented in Nigeria to lower the incidence rate of HIV transmission from mother to child and eventually eliminate it altogether. Questions. 1. Which country has eliminated mother-to-child transmission of HIV? 2. What ways can HIV be transmitted? 3. What drug is used in the treatment and the prevention of mother-to-child transmission of HIV? 4. If you were to conduct a health promotion program for the prevention of mother-to-child transmission in Nigeria, what would it entail? References.